I teach about nutrition and lifestyle to medical students and residents, and as well as a physician. I speak nationally on the topic as well, and I primarily practice lifestyle medicine, but I also do some. Primarily practice primary care, but I also do some lifestyle medicine and integrated health at UCSB. So, let's go ahead and get started. So, hopefully we'll kind of get through the PowerPoint quickly, and then we'll have a little bit of time for questions. So in terms of, so the first slide, I'm not going to bore you all with facts and figures, but the point of it is that causes of death have changed over time. So this is actually data from India, and if you look, communicable diseases have always been pretty significant cause of death in India, but that has really significantly changed. And these data are from 2014, I believe, you can see that most death is really because of cardiovascular. 29% of death is due to cardiovascular disease. You're seeing cancer. You're seeing, and then there's a very small percentage for diabetes. But we'll talk a little bit more about why diabetes is important, and that's because diabetes causes many other problems. One of them being heart disease. So just touching on heart disease, so 25% of all deaths are due to cardiovascular disease, and the reason this is relevant is because the risk of heart disease goes up significantly with diabetes. And basically the point of this slide is to show you overall cardiovascular disease has increased significantly, and unfortunately it's become all too familiar, where a lot of us have heard of in our family someone dying at age 49 from a heart attack, and it becomes very close to home. So prevalence of cardiovascular disease before age 70 is 23% around the world, 52% in India. So the statistics also reflect the reality. Compared to other ethnic groups, Indians develop coronary artery disease and suffer from myocardial infarction, so basically heart disease, at least 10 years earlier. So the point of this is basically that we are at higher risk as Indians for heart disease, and that's why we have to be a little bit more careful. And you'll see that theme throughout this presentation. We have to be more careful, compared to other groups. Burden of diabetes in India. So kind of moving on to diabetes itself. So worldwide, percentage of diabetes in the population is about 10%. So, it looks like it's actually a little bit less, but when you think about it, it's very important because that 1 in 12 adults in Southeast Asian region, basically India, Tibet, Bangladesh, these areas are such a high prevalence because this is one of the highest populations in the world, right? 10% of 1/6 of the world has a very significant problem. And then I think someone may need to mute themselves. We're hearing parents, but the point is that it's not just a problem of the 10% of the population has diabetes. We'll talk a little bit more about the complications, but the complications of diabetes are the most expensive complications, difficult complications. In terms of quality of life and treatment in many ways, and so poorly controlled diabetes, which diabetes is much worse in India, oftentimes, and so it becomes a worldwide problem. So these are the complications of diabetes. So if you have diabetes or you're at risk for diabetes, these are all the parts of the body that are affected. So the eyes, the kidneys, the nerves. So, you know, this is talking about diabetic neuropathy, in which you're feeling numbness and tingling in your feet or hands. You know, we're learning more and more about how it can affect the nerves in the brain as well. And so, you know, you're higher risk for having dementia if you have diabetes. It can cause ulcerations in the feet, and when these don't heal properly and repeatedly get infected, then that is a risk for amputation of the leg. These infections tend to be very difficult to treat sometimes. And then, of course, heart disease, which we talked about before. So, you know, diabetes is one of the number one causes of, it's the number one cause of dialysis, and it is one of the highest. It is one of the highest rates of blindness. So very important. So a precursor to diabetes is metabolic syndrome. So this syndrome is a little bit controversial. There are some thoughts about whether it's as useful as it was once thought to be, but it does help us understand what is the problem. So the definition of metabolic syndrome is basically central obesity. So what is that? Basically big waistline, right? And insulin resistance. And it helps us think about weight a little bit differently, because I think in India we're always like, oh, I'm so skinny, you know, and everything's fine. But a lot of times, even so, you know, there are people who are really skinny and they still have fat around the organs, but there's a pattern amongst Indian folks where, you know, we have sort of big belly and skinny arms and legs, and this is actually the entire reason why we're more at risk for diabetes than other cultures, and Asians also have the same problem. So basically what happens is that you have fat around the organs. And that fat around the organs causes inflammation. That inflammation causes insulin resistance. Insulin resistance is difficulty. So the body is having difficulty listening to insulin. Insulin is trying to tell the body to absorb the sugar that's in the bloodstream, and the body isn't listening. The cells aren't listening. And the reason the cells aren't listening is because they have essentially accumulated small droplets of fat inside of them, particularly in the muscle. And so this is the core of the pathophysiology behind insulin resistance and behind diabetes. And when you understand this, you can start to think about how to treat it. So what is the definition of metabolic syndrome? So the reason I talk about this is because when you go to the doctor, you don't want to just think about, oh, you know, is my blood sugar okay? A lot of times, Indian folks will have high triglycerides and low good cholesterol, which is the HDL. And this combination is often a sign of insulin resistance. The blood pressure also being high, you know, just in isolation, kind of gives us is another clue for insulin resistance. Part of I'm not going to go into how this happens, but it's when you have slightly high blood pressure. Now, you know, according to the doctor, we're not going to give you medicine until your blood pressure is 140/90 a lot of times. But you need to start treating your blood pressure with lifestyle at 120/80. And between 120/80 and 140/90, you know, a lot of doctors will say that the benefits of treating with medication will don't outweigh the risks, and so the real option is lifestyle. So, so you want to address that ahead of time. And then, of course, raised fasting plasma glucose. So glucose is sugar. So if your blood sugar is elevated in the morning, or you want to test for A1C, which is an average of the last 3 months. Pravingar and I were having a discussion about how sensitive A1C is. Part of the excuse me. So, so overweight is very prevalent in India. 39% of Indians are overweight. And Southeast Asians and East Asians have South Asians and East Asians have a higher risk of developing diabetes at lower weights. So what do I mean by this? In the rest of the world, overweight is considered 26 BMI. For Asians, the risk increases of diabetes at BMI of 23. Many of you are shocked by this now because BMI of 23 is pretty low, and yet we're saying to screen at this BMI, and that is because people with pretty low BMI often will still have a lot of fat around the organs, which then causes diabetes. We talked about how metabolic syndrome is central obesity plus all of these risk factors. So what is central obesity? Well, in the rest of the world, women should have a waist circumference less than 35 inches. Men should have a waist circumference less than 40 inches. In South Asians, women should have a waist circumference less than 31.5 inches, and men should have a waist circumference less than 35.4 inches. So this is much lower, obviously, and it's much more challenging. But what it means is that if you have a waist circumference higher than this, then you're at a higher risk. And the same goes for BMI. So sort of 27 is obese, and 23 to 26.9 is overweight. So 1 in 2 Asian Americans will develop diabetes or prediabetes in their lifetime. So what can we do? So first of all, I think that this is very important because Indians tend to be, as we know, we are very social people. We love to go to parties. We love our joint families. We love to have our potlucks. Community is very important to us, and therefore community plays an important role in how we live our lives, how we eat, how we drink, how we exercise. And so what does that mean? So what I'm challenging you to do here is to be an example for your community. Be an agent of change. As a physician, I have very limited power. My power is only limited to my ability to make recommendations. But your power as a mother, as a father, as a son, as a daughter, as a cousin, as an uncle, aunt, all of these roles that you play in society, what that means is that is a circle of influence that you have. And so when you have a party, make it a healthy food potluck. When you host something, make healthy food. If you have friends over to your house, serve healthy food. Be somebody who can be an example. I think, are you somebody who is a candle that creates light, or are you going to just reflect the light in the mirror as a mirror? So that is my call to action to all of you today. So many of you grew up with the food pyramid. The food pyramid is a little bit outdated, actually. We have now moved on to plates, but I like to talk about the food pyramid because, we are fond of another type of pyramid. In India, it's called the Indian food pyramid, the pyramid of rice. And that you see on the plate. This is a pyramid of biryani, but oftentimes we will have a big, cone-like pile of rice in the middle and small amounts of vegetable around it, right? And so, I think that is probably the number one shift that we can make is to decrease the amount of rice that we eat and increase the amount of fruits and vegetables. So just to give you an understanding of really how our plate should look. So, we're talking about fruits and vegetables should be half of your plate. And what does that mean? That's about 10 servings of fruits and vegetables in a day. That in and of itself is going to be a huge change for many of you, but it is the most powerful change that you can make. So my suggestion to you is to focus on how many fruits and vegetables do you eat in a day? And often people will say, oh, I eat a lot. But when I tell them that one serving of fruit or vegetable is about the size of a cup, which is raw, or half a cup cooked, then that's a totally different story. So that's, when you think about what that is, that's, 2 cups in the morning, 2 cups in the afternoon, 2 cups at night, plus, a cup, like a couple, couple cups as a snack, and then a couple of cups as a, afternoon snack. So that's quite a bit. So even increasing by 3 or 4 cups in a day will make a difference for you. The other half of your plate should be grains and protein. And so grains, we're talking about whole grains. Protein, we're talking about healthy protein like beans, nuts, and seeds. Now, there are some folks who will talk about, who will ask me if they can eat lean meat or just meat, period, and what about ketogenic diet. My suggestion is to focus on healthy proteins. If you have diabetes right now, then you can consider adding other types of plant-based protein, such as tofu and tempeh, if you want to add meat, small amounts as a condiment to your dish. So, once a day at the max, 3 times a week ideally is sort of where you should be with this. The government says we should eat dairy, though this is actually a very controversial recommendation, and there's a lot of debate about this in the nutrition community. Harvard, for example, does not necessarily recommend dairy, but certainly water is something that you should definitely add to your day. Small amounts of low-fat dairy have been shown to decrease blood pressure. So here are some examples of healthy plates. So this is actually, these are plates from a colleague of mine, Regina Shaheen, who has a company in India. It's called Invest on Health, and it's an online sort of service that she runs, and it's easy to sign up for. I don't get anything out of referring you to it, but she's a very mission-driven person and would certainly be able to help you. But these are plates from clients of hers. After having education on what they should be eating, they changed their diet, and their health improves dramatically. So just take a look at what a plate should look like. So you have fruits, you have vegetables, you have nuts and seeds, you have beans. Beans count as a vegetable and a protein, and a little bit of kind of bomb or something like that here. Then again, here see big salad, small something, tofu, some curry, and then chapati. Here again, you see lots of sabji, lots of guralu. So we have the salad, we have curry here, we have a little bit of fruit, small amount of millet. There's a big fad about quinoa. Turns out all of our foxtail millet, I think koralu and jannalu, and all of the traditional grains that people were eating are very healthy for us. And then sambar. Here is another one. And so really very familiar food to us, but just we should be eating more of the vegetables and fruits. Increase physical activity in your life. So this is one that Indians are notorious for, because we tend to be disproportionately among the, in sort of professional fields, medicine or IT or law, whatever it is. We're kind of sitting all day long, reading, writing, coding, whatever. And so, so there's 2 things here. So first of all, being sedentary is not good. So being sedentary by itself is associated with increased morbidity and mortality. In addition to that, not exercising. So those are two separate things. So not having any activity, even fidgeting, for example, or walking around lightly, that's bad. But in addition, not having moderate to vigorous physical activity, that's also bad. So so the recommendation is to not only minimize how much you sit throughout the day, but also try to work towards at least 150 minutes of moderate to vigorous physical activity. So what is moderate? Moderate is like you're exercising so hard that you can talk, maybe, but you can't sing. And vigorous is like you can't talk. And 300 minutes for weight maintenance is what is recommended. Now, so first of all, this may seem like a lot. It's about 30, 40 minutes 4 to 5 times a week. But for those of us who are pretty sedentary, it might feel like, really, gosh, how am I going to do this? Now, the fact of the matter is anything is better than nothing. So if you're not doing anything right now, try to do something as simple as walking from, parking your car further from the entrance of the store, fidgeting more, moving to get the remote of the TV, like little things, anything is better than nothing. But even small walks, right, those kinds of things. So, and these are sort of examples of like, sedentary, moderately active, vigorously active, extremely active. So if you are 65 or older, well, these guidelines also apply to you. You don't get a pass. You should still be getting short of breath with your activity, walking uphill, walking upstairs to try to get in your exercise. And it should be, and in addition to all of that, you should also focus on balance exercise in order to minimize falls. The risk of dying increases significantly once you fall. So encourage lifestyle medicine encourage your lifestyle medicine practice in your life. So spend 2 hours per week doing one thing towards your health, maybe. Prep meals. So this is sort of like, what can you start with? Prep meals for the week. Host a healthy food potluck. Have an active outing with your family. Rather than going out to a movie, go for a hike. Increase non-exercise activity thermogenesis. Oh my gosh, what is this big word? So all it is there was some research that started back in the 80s that showed that people who fidgeted seem to have better cardiovascular health than people who just stayed there without fidgeting, who were couch potatoes. So, I mean, try to, at least if you're not active, try to increase all the little things that you do. Maybe get a standing desk, maybe get a treadmill for your table, for your desk. There are treadmill desks. There are, you can try to have a walking meeting, things like that. So what about fasting? We get a lot of questions about this. So actually, it's actually kind of starting to look like a powerful tool. The evidence is little at this point, but compelling. And we're starting, so this is a really interesting study where they looked at men who were pre-diabetic, and it turned out that when they only ate between 8 and 2, they were able to improve their insulin sensitivity and decrease their risk of diabetes. Without even losing weight. Those that lost weight, of course, their numbers improved, but even if they didn't lose weight, they improved their glucose control. So another thing is genetics. So I keep hearing this that, oh, it's in my genes, I can't do anything about it. That is a bunch of hokum. So the fact of the matter is your DNA is not your destiny. Gene expression, I was reviewing an article by a neurologist at Loma Linda who was writing a review about the risk of dementia. And 90% of expression of Alzheimer's, regardless of the genetic makeup, is driven by 4 factors, all indirectly related to the environment. Insulin resistance, inflammation, things like this. So whole foods, plant-based diet, movement, mindfulness, bonding and social connection, environmental toxin exposure, microbiome, all of these things impact gene expression. And the microbiome, you might be thinking, well, you know, what control do I have over the bugs in my stomach? And these are the good bacteria that are in your colon. Well, eating the right foods, basically lots and lots of fruits and vegetables, that is food for your bacteria. So we benefit from, we are what they eat in a way, because because our body is so influenced by these microorganisms. This is a very interesting study. So it was done back in 2000. It was published back in 2006. But I like to discuss it because basically this is about the Pima Indians in Mexico. So the Pima Indians, there's two sort of genetically similar tribes. One is in Mexico, one is in the U.S. The ones in the U.S. were sort of moved and put in a reservation that, you know, they ruled a reservation, but they have very poor access to healthy food, and they're not eating their traditional diet at all because they were moved from their original native land. And they basically have a very high processed food, very high sugar diet. And versus the Pima Indians in Mexico, they have very low incidence of diabetes. And so you can see that, you know, if it was all related to genes, then the Pima Indians in Mexico would all be dying of diabetes as well. But, you know, the fact of the matter is there's only one tribe of Pima Indians and that has such a high rate of diabetes that the National Institutes of Health has a lab right there to just study them, but that is not the case in Mexico. And so this is a picture of my family, and I like to show it because this is my daughter's first birthday, and for my daughter's first birthday, we had a Better World Bash, and we had a healthy potluck, and so everybody brought in a healthy dish. And I will tell you, we still had a really great time. We really, really enjoyed the food, and we enjoyed each other's company. And this is my daughter exercising. She's exercising. So, you know, this is just to remind all of you that this is not just about your health, but about the health of your future generation. Because especially for the women on the phone, you know, the eggs that are in your ovaries are going to give, you know, are basically going to be the genetic makeup, right? The epigenetic makeup, the environmental influences in your body are going to be passed down to your children. And if you have a daughter and that daughter has a child, then how you eat now will influence that child, because you know, the environmental influences that influenced you will influence your daughter's genetic makeup, and that daughter's genetic makeup, the influences on your daughter's genetic makeup, the increased inflammation will influence your daughter's child's genetic makeup, and so and how those genes are expressed. So that's my talk. So I'll just open up the floor to questions if anybody has some.
So I have, your daughter is very cute, by the way.
Thank you. Go ahead, Pravina.
Yeah, I mean, I basically wanted to ask you, you know, some general question in general, like, you know, for example, like, you know, like when you say at 23 is when you have to start monitoring, start checking for diabetes. You know, it seems like a huge, you know, weight loss is such a tough issue for for people. What can we do to to get around that, or do we have like any tools or anything for weight loss that we can use? Or I know working with a nutritionist, you can have how much ever is the difference between your target BMI versus your current BMI, and then if you add in the factor of time, and you can factor some calories in there. But I'm just wondering, what are the tools that are there from a medical community that can tell us?
Yeah. So I guess in terms of from a medical standpoint, there are medications that you can use. If say you got diagnosed with prediabetes, it is possible to be treated with metformin, and that is something that you can ask your physician about. But besides that, if you are in the obese range, you can also talk to your physician about a referral to weight management. So obese range is so unfortunately, from an insurance perspective, it's still BMI of 30, but there are plenty of people at that BMI. And so you would probably want to get a referral for weight management clinic. And there are many medications to help treat help treat obesity. And they're good medicines. This is not some kind of like spa weight loss clinic. This is real science. So that's one thing. But from the perspective of lifestyle, which is the thing that I love to talk about the most. So first of all, fruits and vegetables. Well, actually, even before that, it's your mind, right? You have to work on your mind, because a lot of times people have kind of hang-ups about food, and so you have to kind of get over those hang-ups first. You have to kind of have a goal, like almost in smoking cessation we call it a quit date. We say okay, what's the date that you're gonna change your diet, and you kind of have a preparatory period. Okay, like this is the diet that I'm gonna have. So I have to have all the food available. I have to have, I have to kind of, and then you want to think about your triggers, like what is it that would prevent you from staying on the plan? Whatever plan you pick. There are many evidence-based diets out there, and no diet has been shown to really be superior over another, and so it's really okay to pick different ones, but whatever it is, you want to have lots and lots of fruits and vegetables. That's really important. And then you want to examine your emotions around food. A lot of times people will, eat things because they feel like sort of loss of control, or they have an emotional attachment to certain foods. Some people will feel like, oh, what's there to life if I don't eat this snack or that snack? But that's not all that life boils down to. How about looking at your life as enjoying? You get to enjoy life because you're eating healthy. So that's another thing. Surrounding yourself, taking out the unhealthy food from your house. Take a look in your pantry. What's in your pantry? Is it masala? Is it like those kurkure? You know what I mean? Or Maggi? Or is it or do you have plenty of fruits and vegetables on your dining table that are easy to reach? Those are some really important changes that people should really think about making. The other thing, and that's called regulating the home food environment. The other thing to really think about is, in addition to fruits and vegetables, for a lot of Indian people, for a lot of mothers, for young professionals, older professionals, whoever it is, time is the biggest problem. And so intermittent fasting is something that I've started to recommend more often for people because it does seem to be evidence-based. And And so for that, you would just stop eating at 6 and start eating at 10 or something like that, basically 16-hour window. And, you can actually increase that interval or, maybe do a 24-hour fast on the weekend, once a week, something like that. Increasing your physical activity can be helpful, but you have a limited amount of willpower. So sometimes increasing physical activity and exercise and diet and changing diet at the same time doesn't work. A lot of times people will say, oh, I need to go exercise. You need to stop thinking like that, because actually the evidence shows, the majority of the evidence shows that exercise doesn't help with weight loss. It works synergistically with diet at the same time, but just exercise alone does not cause weight loss. So you need to focus on the food. Counting calories can be frustrating for some people, but for some people it's really helpful. So, writing a journal is good. So literally writing everything you eat. It doesn't have to be complicated. You don't have to measure everything, but just write everything that you eat, and that can be really enlightening for you a lot of times. Because a lot of times people don't eat mindfully. They just eat, they just sort of eat without thinking. So usually I will have people bring in, usually I'll have someone bring in their spouse. And sometimes if the grandma's the one doing the cooking, I'll tell them bring in grandma. So I have called grandmothers at home to give my recommendations. So, you need to get the family on board. So those are all things that you can do. So, any other questions?
Hi, Dr.
Regarding that question, sorry. Yeah, go ahead, please.
Yeah, hi. Actually, whenever I go to my doctor for annual checkup, even though I don't have any diabetes, she always suggests me to take the vitamin D pills. Do you think that is it necessary to take every time?
Most Indian folks are deficient in vitamin D. It's not really harmful to take 1,000 units every day. And so, I think that's not a bad idea. If your vitamin D levels are over 30, then I wouldn't worry about it necessarily, but it's, it's not harmful either.
Oh, okay. Thank you.
Sure. Any other questions?
Hi, Dr. Deepa. So this is Shiva, and my question would be so you said only exercise might not help completely reducing weight loss, and so is that the other way around? Will just diet will just help, or so it has to be both hand in hand?
Yeah, that's a great question. So diet alone works. Diet combined with exercise can work better. If sometimes for some people exercise can sabotage a little bit because so there's emerging science around willpower, and the research is showing that people have sort of a finite amount of willpower in a day. And so if you use it all for pushing yourself with exercise, then you sort of get tired and you don't have enough energy in you to prevent yourself from eating that donut or halwa, right? So
yeah.
So the point is
we'll have a in the mentally we'll be preparing that. Okay, we've done exercise. Okay, we can eat some more donuts.
Exactly. So that's called the substitution effect. So that's very common, and it's actually probably explained by this willpower problem. So people feel tired after they exercise, and then they just go and eat more because they're sort of compensating and they're trying to comfort themselves.
Great, thank you very much.
Yeah, no problem. So that doesn't always happen. So for some people, it can actually work together with diet. So you just have to experiment a little bit. So, you can try to change your diet and exercise a little bit more. And for some people, it seems to help with their, they feel good because they exercised. And so then that seems to filter over into weight loss, enhanced weight loss. But for some people, so now light exercise doesn't interfere with willpower. So if you did say like yoga, Pilates, light walking, those are actually really good, and so that doesn't interfere with weight loss. But I would say try to exercise and change diet at the same time first. Make sure you consciously make a conscious effort not to eat more because you exercise. Like, don't reward yourself. And if you're still having trouble, then maybe try it without the exercise.
Great, thank you.
Sure.